Hi, I'm Debbie Patches,
And I'm Sandy Holowati.
and we're both registered nurses with the Older Adult Rehab Team. We want to welcome you to the Glen Rose Hospital Volunteer Program and thank you for joining us in our orientation for the MoveEz program. Our MoveEz program is about getting patients up and out of bed to walk during the times when they don't have scheduled therapies, like in the evening or on weekends. By doing these activities and exercises, it strengthens them and prepares them for discharge. At the Glen Rose, we work in a multidisciplinary team environment, which includes physicians, nurses, occupational and physiotherapists, respiratory, dietitians, recreation therapists, and yes, even volunteers. Everyone plays an important role in the patient's rehabilitation journey. Although the program focuses predominantly on older adults, opportunities are available to work with other age populations within the Glen Rose. Functional decline refers to the loss of certain abilities and can be the result of age-related changes such as decreased sense of balance or muscle weakness. Sometimes it's related to injuries or insults to the body, such as a fall or a heart attack. These declines can be the reason the patient is admitted to the hospital, or they can occur as a result of their stay in the hospital. By keeping patients active and moving, functional decline can be limited and eventually reversed. The fact is, every day of immobility results in 1 to 5% loss in muscle strength, and for older adults, being in bed as little as 1 week is enough for them to lose their ability to walk independently.
So tell me, Debbie, why would we have MoveEz in a rehab hospital?
Well, Sandy, during the weekdays, our patients are kept very busy with various therapy activities and medical appointments. During the evenings and weekends, however, the level of scheduled activities and therapies are reduced substantially. It's not uncommon to hear patients say, "It's boring here in the evenings and weekends," or to see patients on the weekends basically just go to the meals and go back to bed. That's why having some sort of program during these times may help to maintain the improvements the patients have made with their physio sessions. The goal is to provide them the encouragement and opportunity to stay mobile. As mentioned earlier, all systems of the body are affected by being immobile, so it only makes sense that all systems will be benefited by being active. Here are some of the benefits of being physically active. For your respiratory system, it improves breathing, prevents pneumonia, it helps moving secretions out. For cardiac function, it can help with complaints of dizziness and restoring stronger heart function. Even eating. There's a lower risk of choking if somebody is sitting up while eating. They have better appetite when they're mobile. Around psychological, they're in a better mood. They have better sleep. It prevents loss of muscle tone and strength, and it even maintains range of motion in the joints.
Can you think of anything else that would benefit by staying active and mobilizing?
All patients are assessed by physiotherapy on admission and throughout their time at the Glen Rose. Every week, the physios make a list of patients for the MoveEz program, indicating distances to be walked, what mobility aids are to be used, and any special considerations. This information is found in the MoveEz binder, that's that day-glow green binder on each unit. Also, at each of the patient's bedsides, there is a whiteboard which will also indicate their mobility status and any aids needed to ambulate. All patients' mobility is assessed by the physiotherapist on an ongoing basis and identified by a colored sign on the front of their walker, like the signs you see here on this slide. Volunteers can work with patients that have either a green or an orange indicating independent or supervision designation, as they both do not require any physical contact or assistance. A patient's classification can change during their hospital stay. They may start as a one-person assist, but through their rehab therapy they can progress to either standby, supervision, or even independent. If you notice while you're walking with a patient that they're not performing at the level indicated on their mobility sign, please notify staff immediately. This could be due to dizziness or weakness, or if they're dragging a foot or maybe stumbling. So when we talk about independent, we're talking about someone who needs no assistance to sit, to stand, or to use their walker. But they may need assistance with visual cueing, or maybe reminding to use their brakes, or to help finding their way around the ward. Another thing to notice too is if you're on the unit and you notice a patient walking without help, however they have a yellow or pink sign, the yellow one meaning they need a one-person assist and the pink meaning two-person, please stop the patient and call for staff assistance immediately, because these people are putting themselves at risk. When we talk about aids, sometimes the patients will have a four-wheeled walker. Some of the things to remember about this are that the brakes should be on when patient is going from sit to stand or stand to sit or any position changes. The brakes are on when they are pushed down and click into position. Patients should not pull up on the walker to stand up. They're to use the arms of the chair and then reach for the walker and then disengage the brakes. Patients should stand up straight and stand close to the walker while walking. Please do not push or pull the walker to direct the patient while they're walking, as this can affect their balance and cause them to fall. Four-wheeled walkers are not wheelchairs, so please do not push patients with them seated on the seat. The little seat is there for them as a rest place. So if they choose to rest on the seat, please make sure the walker is on level ground and put the brakes on first. Now this slide is all about sit to stand. Now you and I probably take for granted how to stand up from a chair, but with any weakness or other immobility issues, these simple things sometimes can become difficult. That's why you may be required to verbally cue someone how to stand from a sitting position. So to go from sitting to standing, they want to come to the edge of a chair, keep their feet close to the chair underneath their bottom, use arms of the chair to push up, head slightly forward. Just remember, nose over your toes. And stand up completely before proceeding with the walker. Now to sit down. While using the walker, approach the chair, turn slowly, and turn your back toward the chair. Feel the chair at the back of their legs. Put the brakes on the walker. Reach back for the armrests, and slowly lower yourself into the chair. Some patients have other deficits other than their immobility, and you need to know some of the things to help them get along. When they have hearing deficits, please make sure they're wearing their hearing aids, especially if you're going to an activity or you want to sit and have a chat with them. If they seem to be having trouble with them, please ask a nurse for assistance. It could be something as simple as a battery, or maybe it's not turned on properly. With someone who is hard of hearing, don't raise your voice. Lower your tone and speak clearly. Speak directly in front of them, or if they have a good ear, try to direct your communication there. And please don't talk behind the patients because they don't hear you, and sometimes it sounds like you're talking to someone else. If they have vision problems, ask them if they need glasses, and if you do give them their glasses, make sure they're clean. Don't stand with the light behind you, like in front of a window or a bright light, as then there's a lot of glare and you're just one big black blob. Go slowly from areas of darkness to bright or bright to dark, because as people get older, their eyes don't compensate or don't adjust to changes in light quickly. Always remember respect. Respect people's physical boundaries. Not everybody likes a hug. Always address patients as Mr. or Mrs. unless they tell you otherwise. And please don't use sweetie, dear, or honey. And don't use cell phones while you're here or other handheld devices, as this is can be seen as very disrespectful. And around patients with cognitive problems, don't argue with them. Just keep them safe. They understand you're caring. Even if they have dementia, they understand you're caring for them. And give patients positive feedback about their efforts. Be encouraging. So while you're with a patient, if something should happen, you need to stop what you're doing immediately and notify a staff member. So here's a list of some of the things you want to watch for. Pretty common sense, but also trust your instincts that if the patient does not seem to be acting as you know them to act, get a staff member to help you immediately. If you're leaving the unit, going to an activity, please make note of the unit's phone number. That way, if you need to call for assistance, you will have it close at hand. If something happens with the patient off the unit and they're feeling unwell and unable to return to the unit, you may call the switchboard to activate the nurse response at 33#. And if you're in a patient's room and they take a turn for the worse, or you find someone in trouble, just pull the call bell out of the wall and yell for help. Be sure to call out what room you're in. That way the staff can find you that much quicker. You may also be working with patients who are on oxygen, and that's perfectly fine. But if you're taking them to an activity or for a walk, please have the nurse check the tank and make sure it's full. So, just in case a fall happens, we need to tell you, do not try to get them up. The reason we tell you this is that you can injure yourself or even make the patient's injury worse. So keep them safe where they are and as comfortable as possible. Could mean as something as simple as putting a pillow or a rolled blanket under their head. If a patient has a fall, please stay with them and make sure that they're calm. If you happen to be in the patient's room when a fall happens or you find them having fallen, you can pull the call bell out of the wall, which will activate the emergency call bell, or you can push the red emergency button at the patient's bedside or in the washroom. Prior to leaving a patient in their room, we ask 3 simple questions. Do you need to use the toilet? Do you have any pain or discomfort? And do you need anything before I leave? These are called the universal fall precautions and the Ask 3. If a patient says yes to needing toileting or needing something for pain, let the nurse know so that she can help the patient. It is not expected that you will be toileting patients. Also, before you leave the patient, especially in their room, ensure that the environment is safe, such as the brakes are on the wheelchair if it's at the bedside, glasses, hearing aid, or personal items are well within reach, as is the call bell. If you don't have any universal fall precautions card, ask Daryl to get you one. You can wear it on your lanyard and have the Ask 3 questions close at hand.
So one of the opportunities you will have will be to work with patients that are in isolation. Patients are in isolation because they have or are a carrier of a bug or pathogen that is either highly contagious or resistant to all drug therapy. This can result in serious health consequences to those with low or compromised immune systems. There are different types of isolation depending on the type of infection. You want to schedule seeing isolation patients last, as you do not want to be the source that spreads their pathogens to other patients. Check with the nurse first to see if the isolation patient is up to your visit. They may be actively ill and it may be better not to see them that day. If you yourself are feeling under the weather, then do not work with an isolation patient that day. If you're not sure, ask a nurse as to what precautions to take. If the unit you are to work on is on outbreak precautions, then you'll be directed to another unit until it is cleared or resolved. Patients in isolation are only seen by physio once a day, so any extra activity or walking they can engage in is a bonus to their rehab. Patients that are on isolation are in their own private room and there will be a cart outside their door with linens and supplies. Typically, you will have to wear a gown and gloves when working with isolation patients, and depending on the pathogen, maybe a mask. There are posters on the door providing information as to what is needed to enter the room, such as gowns and gloves or a mask. So this is a sign you will typically see the most. This is for patients that may have something that could spread by touch or by contact. Patients can leave the room while wearing a clean house coat. Check to make sure whether or not they need to be masked. It will be mentioned on the posters. These signs are self-explanatory and they tell you what you need to do or what to wear. If you're not sure, always check with the nurse. Always, always, always wash and clean your hands before and after entering and exiting the room, as we also ask the patients to do the same thing.
Just remember, you can never wash your hands too much.
So you may want to refer to the donning and doffing handout. You want to put a gown on first while you're still outside the room by tying all the ties. That includes the ones around your waist. Then put on the proper size of gloves to fit you and make sure they fit over the sleeves. When removing protective equipment, you want to minimize the amount of exposure to pathogens. Remove your gloves first and wash your hands. Untie the strings of the gown from your neck first, then the waist, and turn the gown inside out. Roll it up, don't shake it, and place it directly in the laundry hamper that are located in the patient's room. Place the used gown and housecoat in the hamper provided and roll it up. Guess what? Wash your hands again. If you're required to put on a mask, pinch the nose for a snug fit. If you're wearing a mask, remove it last and wash your hands after that. Do not have the mask hanging around your neck. You want to minimize the amount of contact with the surface of your gloves. Tuck in your exposed thumb into the other glove to remove it. Turn the gloves inside out and discard directly over the garbage can. Get in the habit of sanitizing your hands when you enter and exit the unit as well.
Don't forget to sanitize between any contact with patients
At any time. Studies have shown that social activity benefits older adults' mental and physical well-being, and that greater engagement in social and productive activity is linked to better functioning and health and greater longevity. You will also have the opportunity to engage the family as well in activities that you're participating in with patients. You can encourage family members to walk alongside patients and yourselves. You will also get the opportunity to work with younger patients as well, such as on Unit 3A. Please note that during your shift, patients should not eat or drink anything. They may be on very restricted diets or have feeding or swallowing issues.
So, if your patient is hungry or thirsty, you must check with the nursing staff first before providing anything.
So signing in and out for your shift will be done in the volunteer lounge as per your volunteer orientation instructions. The processes for each unit is slightly different, so make note of each. Each unit, 4C and 3A, will have a big green neon binder with all the information that you will need to work with patients. On Unit 4C, there are 36 beds and they are divided into 3 teams. The pink team, the green team, and the blue team, with 12 patients on each team. Staff, including nursing, are assigned according to these teams. In the MoveEz binder, you will find documentation as who you saw in your shift, describe the activity, refer to the physio notes, and as mentioned before, the list is updated every week by physio. Remember, nursing is your primary point of contact for any questions, concerns, or issues. So once you get your assignment, check with the nursing staff if the patient is able to participate that day. The binder is located at the nursing desk. This is what the sheet will look like on Unit 4C. It is updated weekly by the physiotherapists. These are the patients that they have identified as able to participate in the program that week. It includes information as their level of assistance, either independent or supervision, what type of walking aid they use, such as a cane or walker, and the distance they can manage. Please note, patients may be moved to different rooms during their stay, so don't panic if you don't find Mr. Smith in his original assigned room. This is not to say you cannot interact with other patients. You just cannot actively engage them in walking until they've been cleared by the physiotherapists. This form will be on Unit 4C and 3A so you can identify which patients you saw during your shift. As we want to ensure that this is a positive experience for you and the patients, your comments about the patient, the program, or your experience is very much appreciated. On Unit 4C, it will be color-coded according to the team, but not on Unit 3A. Don't forget to put your name on the sheet as well as the date. So Unit 3A is the stroke unit, so there are people there of all ages. This is a 28-bed unit that is divided into 4 teams, A, B, C, and D. The patients on this unit range from varying degrees of assistance. On Unit 3A, you will be referring to the MoveEz binder that will have weekly updates from physio that will list the patients, what activities can be done with them, if they require anything extra, and the distance they can walk. On Unit 3A, some patients cannot walk, but you will be able to follow an exercise sheet while they are either in their wheelchair or in bed. They may require special equipment, and there may be other special instructions also. Once again, you'll be checking in with nursing to verify the status of the patients you will be working with prior to engaging them in activities. This is what the form looks like on Unit 3A that is updated weekly by the physiotherapists. If you take a patient off the unit, be aware that you must sign them out on the whiteboard across from the nursing station and let a staff member know. Please note that it is okay for you to take or push a wheelchair for the patient if he or she gets fatigued during your walk. Do not take patients down any stairs. Always use the elevators. As well, do not take patients off Glenrose Hospital grounds. After hours, foot traffic is very limited, so for your own personal safety as well as the safety of your patient, visits down to basement or level 0 is not recommended. In the MoveEz binder, a list of scheduled activities are noted for your reference. Please feel free to inform and invite the participants to partake in these activities.
You know, Sandy, sometimes our volunteers may find that their patients may not want to go for a walk because they're too tired or just aren't up to it. So folks, feel free to sit and have a chat with them. Maybe do a puzzle, play cards, use your imagination.
We here at the Glenrose have a tobacco policy. The east side of the hospital is accessible by the Bill Black Auditorium. It is smoke-free, and there is a $287 fine for smoking on AHS property. This includes all non-patients, including staff, visitors, volunteers, and as they must smoke on street level. There are no exceptions. If you are unable to work your scheduled shift, please contact the unit directly. If you want to contact other units, just call the main hospital line number and ask for the unit you want. So this is just a recap of some of the questions.
So, why is it important for patients to be mobile?
How do you know which patients to work with?
Who do you check in with about your patient's status?
And what do you need to do if you take your patients off the unit? So thank you so much for taking the time and joining us with the MoveEz program here at the Glenrose. Hopefully you have an enjoyable time. Thank you.
Hope to see you in the halls And remember, any time you spend with our folks is a plus for them. So use your imagination and keep that smile.